slice of cake, but they start to choke. Or maybe you've just seen a car accident and you see that the victims that were involved are not breathing. Or maybe you're at home and your dad starts to have a heart attack. What do you do in these situations? You perform CPR. If we do it correctly, you could save a life. We easily could be in any of these situations, and we need to know what to do in case it happens. So to administer CPR correctly, you must perform 3 important steps. Those steps are calling, checking vital signs, and pumping, giving rescue breaths. So in order to perform CPR, we first need to understand what it is. So it actually stands for cardiopulmonary resuscitation, and it's used for people who aren't breathing or they have abnormal breathing, such as people who have had a heart attack. So the main purpose of CPR is to get oxygenated blood to the brain and the heart. So now that we know that, we can move into the first step, which is calling. So when we see that someone's in danger, we're of course going to call 911. And when we call them, there'll be an operator that'll answer, and they'll just tell us that exactly what we need to do. So if you don't know CPR, they can help you through the steps, and they'll also tell you that they're sending an ambulance right away. So after you've called, you can now see if the victim is conscious or unconscious. So the second step is to check their vital signs. So this can be done in 2 different ways. The first one is to check their breathing. So the way that you do this, you can do it either 2 different ways. You can either look at their chest to see if it's moving up and down, because when we're breathing, we can tell. But it can be a little difficult if they're wearing bulky clothes or something that hinders it from seeing that. So another way is to actually put your ear down to their nose and their mouth to actually listen to see if you hear any breathing. So you should do that for 5 to 10 seconds. And the other one is to check their pulse. So you do this also 2 different ways. The first one is to use your index finger and your middle finger, and you can put it either on their wrist, on one of their veins, or on their neck. So you should do that for about 5 to 10 seconds also, just to see. We should all know what a pulse feels like. So after you've checked their vital signs, you can now go into actual CPR. So the third step is to give chest compressions and rescue breaths. So chest compressions are fairly easy to do. You take whatever hand is your dominant hand, and you can put your other hand on top of it. So I'm right-handed, so I'm going to use my right hand, put it on top. If you're left-handed, you can do left hand, put on top. So you want to use the bottom part of your palm, which is the bone, and when you do this, you want to go in the center of the chest. You don't want it to go anywhere else, just straight in the center. So when you're doing it, you want to go at like a pace like this. Each one should not last more than a second. You should be doing about 2 or 3 per second. And you want to do 30 of these. And you'll go into your rescue breaths, which are also called mouth-to-mouth, which we always think of in movies when we see somebody drowning and the cute lifeguard always comes save them. So you open up their mouth, which I can't do on this. It's not real. So you want to cover their nose. Always remember that, because when you are giving them a breath, you want it to go to their lungs, because if it's just going through their nose, it's not helping them at all. So you want to open their mouth, you give them 1 breath. Then you want to listen to see if they're breathing. So you put your head down, then you do your second one. You want to do your listening again. And then you'll go straight back into the chest compressions again. So do 30 of these, 2 breaths, 30s, and then breaths again. You want to do this either until they start breathing again or until the ambulance comes. So when the ambulance comes, they can take over and you've done your job very well. So CPR has saved many lives, and if we all just took the time to learn it thoroughly, we too could save lives. Next time you're at a restaurant, or you've just seen a car accident, or maybe you're at home, just be prepared to perform CPR, because you will never know when you'll need to use it.